Guys, this is Mobeen. We are talking about the capsules of the kidneys. Kidney has two capsules. One is called the true capsule, and the other one is, of course, the false capsule. True capsule is also called renal capsule, and the false capsule is called fascia gerota or gerota. Now, the true capsule is a thin but firm connective tissue layer that is connected around the that covers the kidney, and it is loosely attached to it on the surface. It can actually slip on the surface. However, in certain pathologies, this layer can become adherent to the kidney, and if it shrinks, it will contain the kidney in a way that kidney cannot swell during its function, and the kidney's function can actually become reduced. Now, right outside the true capsule is the is a layer of fat which is called perirenal fat or perinephric fat. This fat, of course, allows the shock absorbing capability. So what happens is that as we do our activities on daily basis, we bounce around. Kidneys are also bouncing around, and the fat around the kidneys provide that shock absorbing capacity. Outside that fat is the fascia gerota or the false capsule. So the perirenal fat is between the fascia gerota and the true capsule of the kidney. Now, fascia gerota. Fascia gerota is a false capsule of the kidney. What it does is it is actually composed of two layers. One layer is in front of the kidney and the other layer is behind the kidney. And then outside the fascia gerota are also layers of fat. So what we say is that because of the fascia gerota, there is a layer in front which is the anterior pararenal fat. So see, the word is pararenal now. Previous one was perirenal. And then the posterior fat, or the fat behind the posterior lamina of the fascia gerota, is the posterior pararenal fat. Normally, the posterior pararenal fat is more in quantity than the anterior. Now, what is the significance of the fascia gerota? The most important thing to realize is that when staging the carcinomas of the kidney, the stage 3 is when the carcinoma is confined within the fascia gerota or within the perirenal fat and has not moved out of that. So that is one. And of course, the fat around the fascia gerota is also for the shock absorbing capabilities. There is some relationship of the kidney failure with the fat around that as well. Not important here. We are doing anatomy. Now, fascia gerota itself, the way it is structured is that it passes in front of the kidney. So fascia gerota, when it passes the anterior lamina, when it passes in front of the kidney, then it passes in front of the inferior vena cava on the right side, and then the aorta as well. Of course, that also means that above the kidney, suprarenal glands are also within the fascia gerota. Posterior layer passes from behind the kidney, and then as it goes medially, it fuses with the fascia in front of the psoas muscles, plus it fuses with the vertebral body. On the lateral side, both anterior and posterior lamina, they fuse, and as they fuse, they will then become continuous with the transverse fascia. So that is the lateral side. Superiorly, what happens is that the fascia gerota comes up above the pole of the kidney, and then it fuses with the anterior layer, so it closes. Then it splits again and encloses the suprarenal gland. Then it fuses again above the suprarenal gland and becomes a suspensory ligament of the renal gland and fuses with the fascia at the diaphragm. And on the right side, it is behind the liver. Inferiorly, both layers do not fuse, they continue going downwards. Posterior layer becomes fused with the iliac fossa's fascia, so iliac fascia, and anterior layer just becomes fused with the fats and the connective tissue in the iliac fossa, but it does not fuse with the posterior layer. So these are the capsules of the kidneys.